right, let's come back into order. Senate Finance. Let's see what we can get done so Senator Scheibel can not once again walk out, walk in, and walk out, and walk in. So, Senator Scheibel, Senate Bill 163, please join us and tell us more. Happy to hear from you.
Well, thank you so much for having me. As you know, my name is Melanie Scheibel. I am the state senator for District 9 in Southern Nevada, and happy to be before you today presenting SB 163. SB 163 came out of the Commerce and Labor Committee in the Senate, and in short, what it does is it prevents insurance companies from discriminating based on a person's gender identity or expression in determining what services, what procedures, what kinds of health care will be covered under their insurance. And so this would apply to independent carriers here in the state of Nevada, including a number of governmental agencies, which is why I am here in front of all of you, the Finance Committee. This would affect our Medicare plan, and I am happy to report that the impact would be minimal on the state Medicare plan, less than $500,000. And I believe that there are representatives here in the room to speak to that, and I know that you like to keep your hearings moving along, so I will just stand open for questions. Happy to talk more about the policy or about the fiscal impact.
Senator Scheibel, I did hear you. I am correcting myself, maybe. Medicaid, not Medicare.
I may have said Medicare and meant Medicaid.
Okay, good.
I think.
Well, that means that my ears are working. Thank you very much in case I need Medicare. All righty. So, all righty. Are there any questions for Senator Scheibel? Everybody's mighty quiet. You saw your opening. Take it. All righty. If there are no questions, we'll go straight to support. Support in Carson City. Welcome.
Thank you. It's wonderful to be here. Thank you, Chair Loop, for hearing this bill. The fiscal notes, for the record, my name is Brooke Malath. I've been here many, many times before advocating for the health and welfare of the transgender population in Nevada. I have also been for 20 years doing business analysis and financial projections for healthcare. And I will suggest that the small financial note is sort of a worst case scenario. I really expect it to be much, much less. But it's really important for you to understand that this fact of covering medically necessary treatment, which is expanding a few services on what Medicaid already does, is because it, to exclude those types of services is discriminatory. What's the cost of discrimination, you say? Because that's the other part of the equation we have to look at. The state of Wisconsin was sued successfully in the case of Flack v. Wisconsin and had to end up covering all of the procedures and pay a $2 million penalty. So we can pay a few $100,000 in the budget, or we can pay a huge amount of penalty. That's what it comes down to. We also have precedent in this state, as was heard in the policy committee, where an individual covered by our own PEB plan filed a complaint because of coverage of some of these procedures, and ended up having the PEB plan covering all of these procedures for everybody, and they had to pay a penalty of $45,000 on top of that, which is about the same price as what the procedure cost to begin with. So do you want to pay once, or do you want to pay triple to quadruple? Covering, approving this financial note means you only have to pay it once. It's the prudent and fiscally conservative thing to do, and I thank you for your vote.
Thank you very much. All righty. With that, any additional Carson City support? Las Vegas, I see none. BPS, is there anyone on the phone lines?
If you would like to testify in support, AB 163, please press *9 now to take your place in the queue.
Good afternoon, Chairperson and esteemed members of the Senate Finance Committee. I am Jamie Jacobs, Jayme Jacobs, a transgender woman who has been a proud employee of Clark County since 2006. Today, I'm here to share my personal experience with medical insurance discrimination and to express my deep concerns about the discriminatory exclusions present in the Clark County self-funded medical plan, which disproportionately affect transgender employees like myself. Due to time constraints, I will not be able to detail my medical necessary gender-affirming surgery denials. Suffice to say, the exclusions in Clark County self-funded medical plan, which specifically target transgender employees, are undeniably discriminatory. They have imposed a considerable financial burden on me and caused significant stress. The process of appealing denials for medically necessary gender-affirming surgeries has been both frustrating and emotionally draining. I firmly believe that all employees, irrespective of their gender identity, should be equitable access to medically necessary treatments and procedures that support their health and well-being. I implore you, as members of the Senate Finance Committee, to address these discriminatory exclusions in the Clark County self-funded medical plan. I urge you to pass Senate Bill 163, ensuring fair access to medical care for all individuals, including those who are transgender and non-binary. Thank you for your time in this critical issue.
Thank you very much. Next caller, please.
Hello, this is L.C. Raker with Silver State Equality, Nevada's LGBTQ plus civil rights org. We are calling in strong support. Thank you for your support. Thank you, Senator Scheibel, for bringing this important legislation forward.
Thank you. Please go ahead.
Good afternoon, Chair and members of the committee. My name is Maria Teresa Lieberman Parraga, MARIA-TERESA LIEBERMANN-PARRAGA, Deputy Director of Battleborn Progress, and just want to reiterate that gender affirming care is health care, and as previous testimony has said, this is a wise investment, especially for people like the public employees we've heard from. Thank you very much.
Thank you very much. Next caller, please.
The public line is open and working. There are no callers at this time.
Thank you very much. Then we will go to opposition here in Carson City. Go ahead, please, when you're ready.
Thank you, Madam Chair. You're all working very hard. My name is Janine Hansen. I'm the state president of Nevada Families for Freedom. We have concerns about this bill. In the fiscal notes, it shows nearly $5 million as a cost to taxpayers. I don't know if that's been changed, but it isn't changed online. So we're concerned about taxpayers paying for this kind of surgery. We're also concerned about the fact that this does not include, and which is discriminatory, a religious exemption for medical providers or small businesses that may have religious objections to providing treatment or insurance for gender dysphoria treatment and sex change surgery. I've expressed this many times over the years in this building that those with religious convictions will be discriminated against. Another issue, I think, is that every time we increase the things that we're paying for with taxes as an ongoing situation, because this is going to be ongoing, it's not going to be for the next 2 years, that we continue to place fiscal burdens on our taxpayers. And I don't know if you're aware, but the Institute for Policy Innovation has stated that federal, state, local taxes, and hidden taxes are equal a person's annual consumption spending of 56%. That's more than they spend on housing, food, clothing, transportation, education, and health care. So the more we burden the taxpayers, the less they're able to take care of themselves with every single thing that we do. Chris Hyde, the director of IRF, said there is a huge uncertainty over whether changing someone's sex is good or a bad thing. While no great care is taken to ensure the appropriate patients undergo gender reassignment, there is great care. There is still a large number of people who have surgery but remain traumatized, often to the point of committing suicide. This is still to some degree not resolved within the medical community. This was a review of more than 100 international medical studies of post-operative transsexuals by the University of Birmingham. Thank you for your consideration, and please consider the taxpayers.
Thank you very much. Please go ahead. Will you push your button to speak?
Thank you.
Good
Good afternoon, Madam Chair and council members. My name is Kathleen Palmer, Palmer. The medical industrial complex is very excited about new opportunities to trans children and adults. While hormones and surgical procedures are very lucrative, medical providers bear none of the responsibility or risk when these treatments fail and leave lifelong complications and injuries. The risk is borne by the victims and their families. For example, when a 14-year-old has a double mastectomy, what happens when this teen grows to be a woman and desires to breastfeed her child? While cosmetically her breast could be restored, function has been lost forever. Jamie Reed, a queer woman who worked as a case manager at the Transgender Center at St. Louis Children's Hospital, shares her experience. One of the saddest cases of detransition I witnessed was a teenage girl who was put on hormones when she was around 16. When she was 18, she had a double mastectomy. 3 months later, she called the surgeon's office to say she was going back to her birth name. She told the nurse, "I want my breasts back." SB 163 should be amended to cover detransition and surgical repairs to organs, not just the destruction caused by transition. It should be amended to protect children and young adults from predatory medical providers, especially since children and teens often grow out of the trans phase, yet the damage from these medical procedures lasts forever. Thank you.
Good afternoon, Madam Chairwoman and members of the committee. I'm here to oppose SB 163 because it would mandate insurance companies and Medicaid to pay for gender dysphoria and sex change surgery, as it also doesn't provide for a religious exemption for small businesses and medical providers. I am sorry for the struggles that many young people are experiencing regarding their gender identity. I grieve for that struggle, as well as those who have chosen the path to change their gender, and it doesn't work. It doesn't give the desired effect that they were expecting. Instead of improving their quality of life, it often does horrific things to their bodies. I have heard multiple testimonies from young people who have severe health issues, including pain and non-functioning urination, sterility, and irreversible damage to their bodies. Please do not mandate this funding due to the extreme nature of this treatment and surgery. Thank you.
Would you please state your name for the record?
I'm so sorry. Pamela Massey.
Thank you very much. All right, please go ahead, Ms. Chapman.
Good afternoon, Chairwoman and Committee. My name is Lynn Chapman, and I'm the State Treasurer of the Independent American Party. And the IAP is concerned about taxpayer money. $5 million is a lot of money. American hospitals have large financial incentives to carry out gender reassignment procedures. In the United States, the sex reassignment surgery market is set to reach a market value of more than $1.5 billion by 2026. Some operations cost up to $53,700. Performing 50 of these a year brings in $2.7 million. We are really very concerned about this because we're talking about $5 million today, but how much will it be tomorrow? We have to think about the taxpayers and what they're already paying for, and surgeries shouldn't be one of the things. And so please vote no. Thank you.
Thank you very much. Any additional in Carson City? Seeing none in Las Vegas, BPS, we'll go to the phone lines.
If you would like to testify in opposition to SB 163, please press star 9 now to take your place in the queue.
Thank you, Madam Chair and members of the committee. My name is Alita Benson, Executive Director of the Nevada Republican Party, testifying in opposition to SB 163 on behalf of the Nevada Republican Party. The 2010 Affordable Care Act roughly quadrupled health insurance premiums, primarily through elimination of medical underwriting and by forcing consumers to purchase coverage they'll never need. For example, the Affordable Care Act famously requires maternity coverage, even for policies sold to men. Insurance professionals saw firsthand the financial devastation caused by the Affordable Care Act. SB 163 continues this destructive path by forcing 100% of consumers to pay for coverage that only a small fraction of 1% of them will ever need. The fifth version of the Diagnostic and Statistical Manual of Mental Disorders estimates that up to 0.014% of males and 0.003% of females will be diagnosed with gender dysphoria. Worse, SB 163 mandates that Medicaid will cover surgical treatment of gender dysphoria. There is no reason that Nevada taxpayers should be picking up the tab for unproven cosmetic treatments. However, the most disturbing feature of SB 163 is that it enables the exploitation of minors by the medical and education industries. This bill allows children to obtain permanent surgical procedures paid for by our tax dollars and does not require any parental notification. The only guidance needed for these children to permanently alter their bodies comes from those who profit from the procedures. Although there is disagreement in the medical field about the benefits and dangers of gender reassignment as a treatment for gender dysphoria, if consenting adults want to opt for the treatments described in 163 on their own dime, that's their call. They have the maturity and ability to properly consider the risks and benefits. But it is unconscionable that we would encourage permanent mutilation of children, particularly without parental notification and guidance. This bill allows children to make permanent decisions with lifelong consequences. Please protect health insurance consumers, Nevada taxpayers, and vulnerable children. Please vote no on SB 163. Thank you.
Thank you very much. Next caller, please.
Hello, my name is Katie Banuelos. That's Banuelos. I'm here representing the Libertarian Party of Nevada. We strongly oppose this bill as it will require all Nevadans to fund dubious and unethical medical practices. This bill requires that insurers cover pharmaceutical and surgical interventions for minors as a treatment for mental health disorder, and these interventions are not safe or reversible no matter what activists and financially interested professionals may claim. Dr. Stephan Levine is an expert. He sits on the Cochrane Review Committee that's currently evaluating the totality of the literature on this issue. He was also an early member of WPATH and helped draft an earlier version of their standards of care. He states that while children with gender dysphoria do report more suicidal thoughts, there's no evidence that they act on those feelings at a higher rate than other children. He also notes that without these interventions, the vast majority of students or children will desist, meaning their body discomfort will resolve. On the other hand, the evidence suggests that social transition and affirmative care sharply increase the rate of persistence. Almost all children who are given puberty blockers will later take hormones and have surgery. Adults who identify as transgender do have a very high suicide rate, but this is not impacted by whether they were able to transition early. Describing these interventions as life-saving care is completely erroneous, does not comport with reality. These are experimental treatments, and all over Europe, we're seeing nations that previously allowed minor transition to change their laws and prohibit it based on mounting evidence that it is not helpful in the long run. The people who push for this and specialize in it are ideologues. They believe that gender is somehow unrelated to the physical body It is that it's able, that you can be non-binary, fluid, and changeable to the point where the term gender means little more than feelings. Okay, simultaneously, they state that little children are capable of knowing a true gender that differs from their natal sex with such certainty that we should permanently alter their bodies and minds with drugs and surgeries. This is an incoherent position. It's not grounded in biological reality or anything we know about child development. Adults can do what they like with their own bodies. They should pay for it themselves. Children are incapable of consenting to procedures of this magnitude. Furthermore, there is no parental right to medically abuse a child. It is unacceptable to force all Nevadans who pay premiums into financing this. Please take a stand for reality and vote no on SB 163. Thank you.
Thank you very much. Next caller, please.
Casey Rogers for the record. Here we go again with the under 17. Again, taking the rights away from parents that make the best decisions for their children. Your bill hit at kids 17 and under while their brains are still developing, not old enough to die in war, buy alcohol or cigarettes, but old enough to permanently maim themselves. All the while, using psychologists, psychiatrists, and physicians as political pawns to this scheme to contribute to taking away of parental rights. Once you let bills like this pass, you start to normalize dysphoric ideology, normalizing many things like pedophilia, normalizing maiming and changing human beings, altering them. The question is why? And why are children at the forefront of this agenda? Actually, you're trying to normalize a transhumanist agenda. Do you even know what that word means? This bill is more than everything aforementioned. People who want bills like this have a nefarious intent to fool the masses into the future they believe in. Least we forget who these sociopaths are working in our legislation. Thank you.
Okay, next caller, please.
Hi, my name is Lisa Partee. It's spelled P as in Paul, A-R-T as in Tom, E-E. I vehemently oppose this bill. Any medical professional who has religious beliefs should be able to opt out of these treatments. And children shouldn't be exposed to these surgeries until they're old enough to know if it's truly what they want and they're of age to make that decision. A prior hearing indicated that no one under 18 would have these treatments, but hormone blockers have to be utilized prior to puberty. And this bill allows kids to have procedures without parental consent. So that testimony was incorrect and untruthful. This is a medical industrial complex money-making machine. Why on earth should taxpayers pay for this? Picking winners and losers for free elective surgeries and treatment is never a good idea. We are overtaxed, overburdened, and really over this whole push to get people to change their sex from that which they were born with. That's a personal choice and decision and journey that we should not have to pay for. These are not medically necessary treatments or procedures. These are elective procedures. Cancer, on the other hand, is not a choice. So if you feel we need to pay for surgeries, how about cancer surgeries that cause many people to go bankrupt in their lifetimes? This is offensive and ridiculous. I would like breast enhancements. If my insurance company doesn't choose to cover these because they're not medically necessary, then I just have to figure it out. But I wouldn't dream of asking other people to pay for procedures I choose to undergo. And I don't appreciate the pay it once or pay it more in penalties idea either. This is not something taxpayers should have to pay for. This is not the lesser of those two evils, and I echo all prior opposition testimony. Thank you.
Thank you very much. Next caller, please.
CYRUSHOJJATY. Thank you so much for all your hard work. I will ditto all the comments. We need to promote good family structure. Birth rates are below replacement level. And by the way, I think I'm the first guy in the testimony out of all the other callers. Interesting. Yield.
Okay, next caller, please.
My name is Susan Proffitt, Proffitt, and I'm the Vice President of the Nevada Republican Club. I am really kind of surprised to see this bill continuing when you are not even looking at the more critical bills that we need for education and elections. Here you want to raise our taxes and have us pay for gender-changing surgeries and services that are not warranted, and you don't even want us to know about it when it's our underage children. This is against the Constitution, as a lot of the bills that I have seen come across our desk from you recently, and I'm shocked. And I just want to ask you, have you decided to wage war against your constituents? I'm serious. This is just egregious, what you all are trying to do to the families. You're destroying the families. I yield my time.
Thank you. Next caller, please.
Hello, everybody. My name is Leslie Quinn, and I'm actually here in Las Vegas. I was upstairs waiting for this. I've been here since this morning. So would you prefer me be on the phone or on the mic?
On the mic, please.
Okay.
Hi, my name is Leslie Quinn, Leslie, last name Quinn, Quinn. I oppose SB 163, which mandates insurance companies and Medicaid paid for by taxpayers to pay for gender dysphoria treatments and sexual surgery. This bill does not include a religious exemption for medical providers or small businesses that may have religious objections to providing treatment or insurance for gender dysphoria treatment and surgery. Many young people later regret the life-changing decision to hormonally and surgically alter their bodies, rendering them sterile. Also, as taxpayers, we object to having to use our tax dollars for this. This is more of a sociology thing, not a biology thing. No matter what happens to anyone, we still have our same chromosomal makeup. This is very damaging political ideology, and I just ask all legislators and my legislators in AD5 and SD8 to stand with me in opposition to SB 163. Thank you.
Thank you very much. Next caller, please.
The public line is open and working. There are no callers at this time.
Thank you very much. And with that, we will go to neutral here in Carson City, neutral in Las Vegas, and neutral on the phone lines, please. Thank you.
If you would like to testify in neutral for SB 163, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. All right, with that, closing comments, Senator Scheibel.
Well, Chair Dondero Loop, Senate Finance Committee, I certainly touched a nerve, it seems. And so I appreciate that we have a lot to do today, but I do want to touch on a couple of pieces of misinformation I think you heard during opposition testimony and point out that this bill does nothing to change the types of care that is available to children and the types of parental notification and parental consent that is necessary for a child to receive any type of medical care in the state of Nevada. What SB 163 is designed to do is to provide for equity. Equity in two different ways. First of all, it is designed to ensure that no matter who your insurance company is, whether it's provided by the state, whether it's provided by your employer, whether it's purchased on the open market, whoever your insurance company is, they all have the same obligations and responsibilities to cover medically necessary care for anybody on their plan. And the second way that SB 163 is designed to provide for equity is to ensure that everybody on each plan gets treated equally, and that everybody gets the access and coverage for whatever procedures, therapies, services that are provided on that plan are provided to everybody, regardless of their gender identity, orientation, or expression. What SB 163 does is it prevents any particular insurance company from providing services to one person who is cisgender and denying those same services to somebody else who is transgender. That is what SB 163 does. What SB 163 does not do is change anything in Nevada law, policy, or in the medical administration codes, the Nevada Administration Code, the medical standards of care, medical practices, the licensing boards for physicians, physician's assistants, certified nurses, RNAs, RNs, there's the word I'm looking for, there's a term, RNs. It doesn't change their practice areas, their scope of practice, the types, the procedures that they are and are not allowed to do, provide, conduct here in the state of Nevada. What it says is that if an insurance plan is going to cover any particular procedure or therapy or treatment, they have to provide that to everybody on their plan, regardless of that person's gender or sexual orientation or identity. It doesn't say that any particular plan has to cover any particular type of treatment or procedure. It doesn't say that any particular provider has to cover a particular therapy or treatment or procedure. It also doesn't say that any procedure that we have previously considered or that the medical board has determined to be unsafe will suddenly be able to be performed in the state of Nevada. It says that those procedures and treatments that are already available in the state of Nevada must remain available to everybody on a particular insurance plan, regardless of whether that insurance is provided by an employer, the state, or through some other means. And so it is inaccurate to characterize SB 163 as a giveaway, as a tax-funded provision of services to people who are not otherwise entitled to them or who are not otherwise receiving them. It is, in fact, the state of Nevada has made the decision to provide medical insurance to certain people who qualify in this state. So it is also incumbent upon us, as we go through this legislative process, to ensure that the way that we provide that treatment is fair and equitable across all of those who we decide to provide it to. And so the people who pay into the system that provides publicly funded medical care, taxpayers, including our transgender and gender nonconforming and gender non-binary Nevadans who also pay taxes here, have to pay into that regardless of wherever that money is being spent. And it is simply not our role as legislators to sit here and pick and choose which services will be provided to which people and which services will not. And that's what SB 163 says. When an insurance plan, including the insurance plans provided by the state, either through state employment or through the Medicaid program, provides for a certain service, procedure, treatment, that they provide it equitably for everybody of every gender and every orientation and every expression. And so I look forward to seeing SB 163 pass this committee.
Yes. Senator Titus.
Thank you, and thank you for coming back up, because I was just wondering how many other states have passed this legislation or in a similar form of this for their Medicaid participants.
I could get back to you with the list, but there are other states that have similar provisions in law.
Thank you very much. Any additional questions for Senator Scheibel? All right, thank you very much. And with that, I will close the hearing on Senate Bill 163, and we will open the hearing on Senate Bill 416. Welcome back, Senator Scheibel, and guests. Please go ahead when you're ready.
Thank you so much, Chair Don Darrow-Loop and members of the Senate Finance Committee. My name is still Melanie Scheibel, and I am still, as far as I know, the state senator for District 9. Happy to be in front of you presenting SB 416. SB 416 is the Senate Judiciary Committee's bill, and I am lucky to chair that committee, which allows me to be in front of you today introducing it. But I have much more qualified and competent people to explain the bill to you. I just want to give a little bit of perspective on some of the numbers that you're probably seeing. And kind of the genesis of the bill, but I promise I won't be too lengthy because this is all about money. And over the course of the last 2 interim sessions, on the Interim Judiciary Committee and the Standing Judiciary Committees have learned a lot about the cost of incarceration here in the state of Nevada and seen that a lot of the cost ends up falling on the families of those people who are incarcerated. Because when somebody is incarcerated and they want or need to buy something from the commissary, for example, it is the families who put the money on their books, and then it is the person who is incarcerated who can then go to the store and buy necessities like soap and shampoo and toothpaste. And so over the course of the last 4 years, the Fines and Fees Justice Center has partnered with the Nevada Department of Corrections and the state of Nevada to identify some of the places that are the most cost-inducing parts of our incarceration system, and identified in SB 416 3 key areas where we can reduce the cost of incarceration for people who are incarcerated and especially for their loved ones. And so I will let the representatives here from the Fines and Fees Justice Center kind of walk through the 3 sections of the bill. And I'm not trying to hide the ball. We understand that this is a big ask. And we have reached out to partners in the governor's office and at NDOC to try to pare down the requests. And at this late moment in the legislative session, we remain open to conversations and hope that this committee will help us in identifying the pieces of the bill which are most practical to move forward with today, and those which might be better saved for another conversation in another interim and another session.
Good afternoon, Chair Don Darrow-Loop, members of the Senate, the illustrious Senate Finance Committee. I am Lisa Mosley, the Nevada State Director for the Fines and Fees Justice Center, and we are here today in the spirit of compromise to present to you SB 416. I'm simply going to introduce our team, and then I am going to turn it over to Mr. Shepak to actually walk you through the bill. Joining us today is our Deputy State Director, and I like to refer to him as our resident expert on all things incarceration and the impact that it has on families and community, Nick Shepak. I think you all know him well. We also have via Zoom today, I'm very excited to introduce to you all Lillian Patil. Lillian is our senior analyst for state and local budgets. She has written and submitted a budget memo that you all have in the exhibits that you can see, and she is here to walk us through that memo and to walk you through her fiscal analysis and answer any questions that you may have regarding our analysis. Rounding out our team, if we need her today, is our public health specialist, Ms. Katie Brandon. Katie is here to speak to the impact that these fees have on the incarcerated and their families, and to, if we have time and necessary, to present some numbers for you. And so, again, I want to thank you in advance for considering this bill, for considering our analysis, and the reasons why we believe that it is imperative that these issues that this bill aims to address be addressed. I also want to thank Director Zorinda and his team at the Nevada Department of Corrections for his willingness to engage with us in robust conversations, and to they have open minds and have been talking with us consistently. So I want to just thank him and his team. And with that, I am going to turn it over to our Deputy State Director, Nick Shepak.
Good afternoon.
Go ahead, please.
Thank you. Good afternoon, Chair Don Darrow-Loop and committee members. My name is Nick Shepak, and I am the State Deputy Director of the Fines and Fees Justice Center. As mentioned, this bill is a culmination of multiple years of research into the cost of incarceration, which has shown us that essentially the state has, over many decades, moved to a sort of backdoor tax to fund essential government services on a very small group of families of incarcerated individuals who have done nothing wrong except love somebody who is incarcerated. I will quickly walk you through the areas of the bill where you are seeing the physical notes come from. So SB 416 looks to address these costs by to families through the following measures. One, it eliminates medical copays, which in Nevada, we have the highest medical copays in the country. Our research has shown that this is a major deterrent for people to seek preventative care, leading to very high, very expensive and worse health outcomes for those individuals. It eliminates man-down fees. These are emergency medical fees charged at NDOC that are levied against individuals who commit self-harm, attempt suicide, or get hurt during recreational activities. It reduces the cost on commissary items by placing a cap on markups. Nevada has one of the highest commissary markups in the country. The vast majority of this money is spent on commissary comes directly from families. The food and other items bought at commissary supplement what is often described as low quality, low portion, and nearly inedible food. Currently, NDOC is holding over $14 million in profits from families in the offender store fund. This surplus rolls over year to year. I do want to commend the director and his department for eliminating markups recently on hygiene items, though. We also are looking to eliminate NDOC's ability to charge room and board to those who have jobs. Many jobs pay far less than $1 an hour or as little as $10 a month. Currently, only people who have jobs are charged these fees, creating a deterrent to work and a punishment for those who choose to do so. And lastly, this bill deals with debt upon release. By eliminating outstanding medical and institutional debt upon release, current practice has led to individuals leaving incarceration with anywhere from hundreds to, in at least one case, over $100,000 in debt upon release. These individuals are often sent directly to collections, and their credit is ruined, making re-entry into society very difficult. Collection rates, according to a public records request we received from NDOC, are often less than 1% a year of this money. We are also asking that nobody leave the Nevada Department of Corrections with less than $100. As it is very difficult to re-enter. However, we believe that the cost-saving measures in this bill would eliminate much of the cost of the state to ensuring that individuals had $100. And as was mentioned, we understand this is a very robust bill with a significant fiscal note. While we are confident that this is the direction that the state needs to be moved, we are happy to work within the confines and priorities of this committee to ensure some relief for families. I will now pass it over to FFG's budget analyst, who will briefly explain her analysis of the fiscal note and recommendations. Thank you.
Go ahead, please, when you're ready.
Thank you. Good afternoon, Chair and committee members. Can you hear me okay?
We can. We
Great,
can.
thank you. My name is Lillian Patil, and I am the Senior Analyst of State and Local Budgets at the Fines and Fees Justice Center. I'm happy to be here with you virtually today to briefly summarize the fiscal analysis memo that we have submitted in support for this bill. We recognize that the full implementation of this critical piece of legislation would require annual state general fund support to replace the way that the Department of Corrections currently assesses fees on incarcerated individuals and their families. So we wanted to consider where that general fund need might be able to be arranged or be minimized or offset. So we conducted a fiscal analysis of each component of the existing fiscal note using publicly available data and came up with a revised estimate for the revenue loss that would be associated with this legislation of about $4.9 million a year or $9.7 million over the coming biennium. Our estimates differ from the original fiscal note of about $6.1 million per year, primarily in the areas of commissary markups and medical debt. We believe the cost of limiting commissary markups to 5% may be less expensive than originally estimated because we factored in the likelihood that once commissary items are no longer marked up, people will purchase additional items at that cheaper price. Even if you assume additional inventory purchasing needs, we estimate this could result in over $800,000 of additional revenue. Secondly, we believe the cost of eliminating medical copays and reimbursements may be also less expensive than currently estimated based on public records data and budget data about revenue collections from the past few years in these areas. So after coming up with a revised fiscal estimate, I also built a model to demonstrate how the state could minimize the need for general fund appropriations for at least the next 5 years. To do this, we recommend that the state use a portion, about $5.7 million, of the recently identified ARPA savings over the next 2 years to replace lost revenue in the Department of Corrections budget. This would reduce the need for general fund support for this bill, but importantly, it would also help ensure that ARPA funds are being utilized by that December 2026 deadline and avoid any possibility of reversions of funds to the Treasury. We also recommend using about $1 million per year from the Prisoner Store Fund's fund balance for 3 fiscal years after that, which further offsets the amount of general fund that would be needed to then plug the remaining revenue gap created in this bill. This fund has built up a significant surplus in recent years from the revenues primarily generated from fees on incarcerated people and their families, and we believe it is only right that it is used to help reduce the financial burden for these individuals in the future. Using our model and the revised fiscal estimate, we show that if these 2 recommended revenue sources are used over the next 5 years, the state would only need to appropriate about $2 million of general fund per year for the upcoming 2 years, and then gradually increase that support to about $3.8 million in fiscal year 26 and about $4.9 million in fiscal year 29 and beyond. Of course, we know if the bill is modified, that estimate changes, but we do believe general fund can still be minimized in any situation by the strategic use of ARPA funds and Department of Corrections store fund balance. Thank you for the opportunity to advocate for this legislation, and I'm happy to answer any questions you may have about this fiscal analysis.
Thank you very much. Additional presenters, Senator Scheibel? Okay. All right, questions from the committee. Senator Wynn.
I'm looking at the fiscal note here, and I'm seeing the copay elimination. Do you know if people are to the point where they can't afford the copay and so they're not seeking some preventative care? Some of these costs would immediately be eliminated because you would be able to give someone an Advil as opposed to, having some sort of surgical procedure. Is that my understanding?
Nick Shepak, for the record, that is correct. The individuals we have talked to have been very clear that they are not seeking medical care until it is medically necessary due to the cost.
And I also want to clarify, just because I know a lot of people that are on this committee don't sit on the Judiciary Committee and heard the policy, but the room and board reduction revenue, that specific line item in the fiscal note that is about $482,000 per year of the biennium, just to be clear, those are people, when you get a job and you are being paid, you are then responsible for paying room and board. Whereas if you don't work and you don't get a job and you don't have any skills, you get free room and board. Is that correct?
Nick Shepak, for the record, that is correct.
Okay. So by including this and eliminating that, people that are working would no longer have to pay for their, I guess, quote unquote, room and board, and they would be similarly situated to people that sit on their ass and sit on their butt and do nothing. Excuse me.
Nick Shepak, for the record, that is correct.
The chair is going to smack me over here, but
hit that button.
Yeah. Sorry for people that have to bleep that on YouTube. And then as far as the discharge of debt, is that the average debt per year? Is that where that number, that 71,000 comes from?
Nick Shepak, for the record, we can have the Department of Corrections correct us if I'm wrong, but that would be the collected amount of debt, not the assessed amount. There is well over $1 million or $10 million of current outstanding debt. They are collecting about that 71,000.
Thank you.
Okay. If that wasn't enough information, we'll go over to Senator Neal.
Thank you, Madam Chair. I dig it, though. All right. But so I want to, because I just want to say this too, because, I had a bill that was similar in terms of convict leasing and charges and et cetera. But wasn't this in the prior governor's audit around the discharge of debt and making sure that once you release a prisoner, the debt is not following them post-release, and then basically you're collecting from a person who was incarcerated and is then in poverty.
Nick Shepak, for the record, there were multiple recommendations in the audit from the governors. I have not heard of any movement on any of those recommendations myself.
Okay. And then the other part on where it's saying that the $100 for releasing the offenders, what was the prior amount that you would be released and they would give them and say, you're free, here's the money, and go find, I guess a shack, but I don't think that's even available. How much?
Nick Shepak, for the record, the current minimal amount is $25, and if you remember the story of DeMarlo Berry, that was what he was released with.
So what has corrections said about the fiscal note that they applied for giving an additional $75 to a released offender? They said that this is a burden, they can't absorb this cost.
Nick Shepak, for the record, I have not had detailed conversations about this specific part of the fiscal note with the department. They are here and they can probably speak to that themselves.
I think $100, I don't know if that's reasonable, and I don't think it's unreasonable to say that you actually get $100. I don't know. I think that'll pay for a bus and a one night in a weekly, maybe. So I'm just saying, $25, I don't know where it got you. I guess it got you down the road. So I guess we have to ask more questions to NDOC.
Thank you very much. Additional questions? Senator Titus.
Thank you, Madam Chair. Along the same line, Section 9, Number 4, again addressing if an offender does not have more than $100 in his account, then it should be we should bring that balance up to the offender to give him $100. And I'm just wondering, so while they're incarcerated, they can spend down the money and use the money, always knowing that they're going to have that infusion of the $100 at the time of release?
Nick Shepak, for the record, the current deduction scheme, so anytime an individual makes money or gets money put on their books from their family, a portion of that money is taken and placed into a savings account. That savings account currently has a cap on it. However, if you owe outstanding medical debt to the department, they will take from that savings currently.
What's the cap?
The cap, I'm not sure off the top of my head what the cap is. Nick Shepak, for the record.
Follow up, Madam Chair, in the same section, then number, I think, L, and it talks about discharging, if there's any debt owed by the offender at the time of discharge, unless the money is owed by the offender to the department of all the subparagraphs, then it's all supposed to be it's just supposed to be ignored and not, they don't have any debt. So do they know that so they can continue to accrue debt knowing that they're not going to be responsible for that debt at the time of release? So how much debt are they allowed to accrue over a period of time, knowing that it's all just going to be forgiven when you're released?
Nick Shepak, for the record, the vast majority of debt that anyone is released from NDOC with is medical debt from necessary medical procedures. So from our perspective, individuals are not likely going to break more ankles because they're not going to have to pay for it upon release, which is, we had one individual who had a $10,000 medical bill upon release from a basketball injury. But what we're seeing in collection rates for that debt is anywhere from 0.6% to 1%, so that money's not being recouped by the state currently.
And thank you. Along that same line, the medical debt, because medical debt is one of the horrific things that's happening in our nation for all folks, not just prisoners, but the amount of medical debt that people are accruing over a period of time now is pretty phenomenal. I'm just wondering, most folks have to set up a payment plan or look at how we're going to play that debt. And when they're in prison, do they have any of those obligations to look at paying off that medical debt, setting up some kind of contracts, or that just doesn't happen?
Nick Shepak, for the record, and thank you for the question, and I agree with your concerns. And it's my understanding that there's a certain deduction scheme where while they are incarcerated, a certain amount of every dollar that is placed on their books, whether it's from family or from a job, will be taken and put towards that debt. Upon release, they have, and it's either 60 or 90 days to fully pay off that debt. If they do not pay off that full outstanding balance, they are then set to a collection agency that is contracted with the Nevada Department of Collections, and they are on the hook for that whole amount to that. So I have not heard of any individual who has been put on any sort of payment plan or walked through financial options for any outstanding debt upon release from the Nevada Department of Corrections.
And finally, just as a comment, in healthcare, we use the term warm handoff, and certainly I wouldn't discharge somebody from the emergency room, put them out in the wheelchair on the sidewalk without knowing that they have someplace to go. And I do appreciate what I see as an intent of this bill is that as you discharge folks from incarceration, they have to be at least given some direction to go, and not just here, here's your bag of stuff and goodbye. Hopefully we don't see you again, because obviously we know that's not going to be the case. So again, I thank you at least for the intent of the bill.
Go ahead,
Chair
please.
Don Darrell, if I may. We have with us our public health specialist, Katie Brandon, who has some numbers related to surveys that we administer to incarcerated folks that outline the impact of the medical debt that they are released and the average amount of medical debt that someone comes out of prison with. And if we have just a couple of minutes, if you'd like to hear some of those numbers, Katie is here and could expound on that for you and just share with you those numbers and what it looks like when someone is coming out of prison with that debt and the impact that it has to them and their families. This is not a Senator elective debt where someone just says, I want to have a procedure, I'm going to go in and do this and charge it to my account. That's not what's happening. This debt that people are coming out of prison with is debt that just for going and saying, I have a sore throat or something like that, those things cost. The average copayment in Nevada is $8 per visit. Across the state, I believe the average pay, correct me if I'm wrong, Mr. Shebeck, is $2 to $4. Here in Nevada, it's $8. So anytime an inmate decides or needs to see a doctor, they are charged $8. And Mr. Shepak mentioned earlier what someone who has a job in the Department of Corrections makes. It's less than $1. It's less than $10 a month. So if they need to see a doctor and they're making less than $10 a month, that's $8. That's $8 of their pay. Not to mention their room and board that also comes out of that income. Not to mention any other debt that they are responsible for paying also comes out of that. And so that is where that debt is being accrued.
Thank you very much. Additional, Senator Harris.
Thank you, Chair. So Senator Neal mentioned the audits that were performed on NDOC, and if I remember correctly, there was also quite a bit of discussion in that audit about the commissary prices. Is that right?
Nick Shepak, for the record, that is correct.
And are you all aware of efforts being taken to address that part of the audit as well?
Nick Shepak, for the record, the Nevada Department of Corrections has eliminated all markups on hygiene items, which very clearly shows some effort to work towards that. We have heard that there is work on addressing the overall costs, and we've also seen support from the Nevada Department of Corrections to run those policies through the 233B process. I do not know where they are in the full process, though.
Am I correct in understanding that this bill, however, would go a long way in addressing some of those issues for the rest of the items that NDOC hasn't quite got its arms around yet?
Nick Shepak, for the record, that is correct.
And just one more, Madam Chair, if that's okay. Thank you. Are you all aware of how many states fund their Department of Corrections off of the backs of incarcerated families versus out of the general fund?
Nick Shepak, for the record, each state that we have studied uses a very different funding formula, but we can confidently say that we rely more heavily on funds from incarcerated individuals' families than the vast majority of states.
All right, thank you.
Thank you very much. I would just weigh in with a little bit of a comment and a question. My understanding of prison has always been that we send somebody to prison to pay their debt to society, but we also send them there to rehabilitate them, right? We don't want them to come out as they went in for whatever they did. I mean, there's lots of reasons people go to prison, and I'm not an attorney, but I'm sure Senator Scheibel could give us, 25 reasons right off the top of her head. And so with that being said, I believe when we're trying to rehabilitate someone, we're trying to also teach them something, because they may go in, the vast majority of them, as very young people. So and there's nobody sitting here on this dais that cannot say, I don't think, that when they were 18 or 19 or 20 or 21, they were very different than when they are right now. And that includes money, social graces, whatever it may be. So with that being said, I feel like that I have to say, when I heard that if you didn't work, you didn't pay, in judiciary, I was shocked. I don't know how that piece of information ever escaped me, because I've been on judiciary sessions and sessions, but I felt like we were rewarding them for not doing that. And by saying that, I mean that we're not teaching them some rehabilitation skills, if you will. So what we want people to learn is to be responsible, pay for what they need, and be a responsible citizen in prison, out of prison, wherever they are. But a couple things struck me when we heard this, and while this isn't a policy committee, one of the things that struck me was that women offenders in prison paid for personal products differently also. Those are not things that anybody has a choice over. So it's not like going to get more yogurt, right? So I was very surprised about that. So I just think we need to put this into perspective, that we're trying to rehabilitate people, teach them responsibility. And yes, maybe it isn't our job to teach responsibility, but when you have, once again, an 18, 19, or 20 or 21-year-old in there, it is our responsibility, because if we don't teach it and we don't give them some parameters and some things to learn, then just like their GED that they may not come out with, we're sending them back out into the world to do exactly the same things that we hope they don't do again. So I don't think there's a question in there. It's just some observations as we went through this. So Senator Scheibel, you have helped me out before. If you want to weigh in, please go ahead.
Thank you, Chair Don Darrell-Loop, and I think that you are absolutely correct in that, especially with your perspective on the purpose of sending people to the Department of Corrections and sending them to prison. The purpose is that they serve their time there, and also that they are rehabilitated, and we want to set them up for success when they leave the Department of Corrections. I also think that we really can't compare the experience of living, working, having an income and spending that money and receiving medical care in prison to anywhere else in society, because people are restricted to that Department of Corrections environment, and they don't have choices. They don't have choices in their medical providers. They don't have choices in the jobs that they have. They don't have choices in where they bank. They don't have choices in how they spend their time. They don't have choices in who they spend their time with and what kinds of educational opportunities they can seek. Certainly, we are doing better to provide more choices and to provide opportunities, but there is no substitute for freedom. And so it really, in my opinion, is not fair to stack on top of the punishment. The punishment is supposed to be being removed from society, being taken away from your loved ones, being isolated for a given period of time. And then when we add additional burdens on top of that, coming out of this situation that they did not choose for themselves, with debt, without the skills to be able to return to work and be a contributing part of their families and their communities, that's above and beyond what the purpose of prison is. And so whatever we can do to ensure that prison to make it what it's supposed to be, and not to create these additional collateral consequences for people who spend time in prison, I think is the right policy decision, and we should put our money where our mouth is.
All right, thank you very much. And I think that at a very minimum, we need to think about, co-pays and room and board or whatever they're paying in perspective with their pay. I certainly, if I was making $1,000 a month, I can't go rent a $1,300 a month apartment, right? I mean, I know that. But if I'm in a situation where I have to pay room and board, if I make $10 and I have to pay room and board as $8, that's different, right? So I think those are certainly good questions. I think they're good learning situations. I mean, they're learning how to do things. But I hope that we can, you can have some more discussion on this bill, and that we don't have very many days left, but perhaps we can come to some balance there and we can figure it out. So thank you very much, and thank you for bringing the bill to us. And we will go to those in support of Senate Bill 416 here in Carson City, in Las Vegas, and on the phone lines. Anybody on the phone lines for 416? Anybody?
If you would like to testify in support.
No, please go ahead.
If you would like to testify in support of SB 416, please press star 9 now to take your place in the queue.
Hello, my name is Nicole Williams. I'm calling today in firm support of SB 416. Unless you've experienced being incarcerated or have had a family member or friend that's incarcerated, I truly don't think you'll ever know how much of a financial burden the cost of incarceration is. When my husband was sentenced, I thought that $50 to $100 a month added to our already tight budget would be sufficient in helping him get essential items he would need, and to add phone time so he could call his children and I, along with his elderly mother and other family members, basically his support system. I was so wrong. Food prices are outrageous. 15-minute phone calls go by so fast, and there is a fee to add money to your account. We are unable to visit because I cannot afford to drive 800 miles round trip, rent a room, and also have money for the vending machines in the visiting room, which are also super expensive. Quarterly food and clothing packages have a spending limit, and the prices are sky high. Pretty much everything in prison has a cost or fee involved, and I mean everything. Medical co-pays, room and board fees, families have to pay body retrieval fees if their loved one passes away in prison. The list goes on and on. Please vote yes to pass legislation so that Nevada can fund its prisons through the general budget like many of our neighboring states do. Families should not have to pay any portion of their loved one's incarceration. Thank you.
Thank you very much. Next caller, please.
Hello, my name is Betty Guess. That's Guess, and I am calling in support of SB 416. My husband and I have a son incarcerated by the Nevada Department of Corrections. We no longer live in Nevada, so visiting is a difficult situation. We live in Indiana, some 1,800 miles away from our son. We are both in our mid-70s and rely mainly on our Social Security benefits to survive. My husband still has to work as an Uber driver just to make ends meet. We also use some of that income to send to Corelink so we can send emails to our son. And then we have to pay money to secure us so we're able to talk to him on the phone. That money often runs out before we can afford to send more. We don't have any money to send him clothing or food packages. We, like so many others, were under the false impression that the state would supply what he needed while he was in their so-called care. We have since learned that if he doesn't have money to buy extra food in the commissary or spend on additional clothing items, then he could go hungry most of the time and be wearing out his shoes and clothing well before they are provided more. Neither incarcerated persons nor their families should have to pay for the cost of keeping them in prison. Please take this burden off the backs of innocent families, most of whom are already struggling to survive themselves because they have lost the income of their loved one. We stand in strong support of SB 416. Thank you.
Thank you very much. Next caller, please.
Hello, my name is Pamela Browning. My loved one has been incarcerated for 9 years. Before making a bad choice, I sent him. He was the sole provider for 4 children, which now I make sure they have all the things needed, such as school clothes, shoes, and supplies, and do my best to make sure they have decent birthday and Christmas. One big impact this has on our household is not being able to do the things kids should be doing at the age, whether it's going to the movies, taking them to the beach, seeing Disneyland, or riding on a roller coaster at Magic Mountain. I make sure he continues to have strong relationships and open communication with his children, and through this time, which cost me $400 a month to keep money on the phone. This is very important for all parties. Aside from his children, I also make sure he has what he needs as far as certain hygiene, clothing, and food not sold on commissary. Once every 3 months, I send him hygiene clothing packages with things like socks, t-shirts, jeans, shoes, and thermals for when the cold weather comes. And this adds up to $250 real quick. Also, every 3 months, I spend $150 on food packages, which is needed due to not getting enough or decent tasting state food and inconsistent commissary spending. Then for him to maintain in between these packages and to cover any medical copays or man down fees he may have, I send him $400 a month. Now that I am the only provider, I work 2 jobs just to maintain all of that, on top of my rent, $1,200, my car payment, $600, and there are utilities, food, gas, and personal items. I can't afford to get sick or we'd all be homeless. No matter if the state pays for it or the families, the state still pays for it, but the impact is felt by the families. I strongly support SB 416.
Thank you very much. And next caller, please.
First, I want to thank you for your time. My name is Crystal Voigt, and my fiance is currently incarcerated in NDOC. When my fiance describes the amount of food they are served, it's less than a child's meal. A small ice cream scoop of eggs, 1 slice of toast, and a tablespoon of peanut butter for breakfast. I currently send him $300 a month to order food and hygiene, and $100 a month for the phone. Of the $300, $50 goes towards hygiene and the rest on food. The cost of commissary is so high, it's a struggle to ensure he's getting enough nutrition. When he was on store restriction, he lost almost 20 pounds. A ramen soup, which is 30 cents in a regular store, is sold for $1 at their store. And 1 pack of tuna that is $1.50 at Walmart is $4.95 on the store list. I am the sole provider for our household. I have 3 children, and it's a struggle every month to make sure bills are paid, plus have additional money to send to him, not only for store, but for his medical. A few months ago, they took $80 from his account for medical copays, which we weren't expecting, so for those 2 weeks, he wasn't able to get any commissary. The cost of his incarceration is so high, and it's falling on to us families who are struggling. I want to support him through his journey of rehabilitation so he can be successful when he is released, but I need help. Also, when my fiance is released, he will face the challenges of starting a new successful life. The thought of leaving with thousands of dollars of medical debt before even obtaining a job is very discouraging. I would add him to my insurance, but because he's incarcerated, they would not use our insurance. I want my fiance to exceed and focus on his rehabilitation, so I'm willing to do anything to help him, but we need help. Again, thank you for your time. I am in support of SB 416. Oh, my name is Crystal Voigt, Crystal, last name Voigt, V as in Victor, Oight.
Thank you very much. And with that, another caller, please.
Good afternoon, Chair and members of the committee. My name is Maria Teresa Lieberman Barraga, MARIA hyphen TERESA LIEBERMANN hyphen PARRAGA, Deputy Director of Battle-Born Progress. And it has been heartbreaking to hear the stories before me. I'm not someone that has someone in the system, but I am someone that, as was mentioned earlier, has seen increased costs in my medical services, but as the sponsor mentioned, I have the freedom to be able to seek out care somewhere else, or to work with my insurance, or work with my doctor, or heck, even ask for a raise at work so that I can have more money coming in. The people we're talking about here do not have that freedom, and that's why we need this bill. Please support SB 416.
Thank you very much. Next caller, please.
My name is Elizabeth Gutierrez, and I'm in support of SB 416. My husband is currently incarcerated, and I'm directly impacted by this. Markups and copays put a ton of pressure on our family. I had to start working 2 jobs to be able to afford to take care of our daughter and to be able to support my husband so that I could put money on his books for commissary, phone calls, packages, and so that he could have a decent amount of food and necessities. Not only does our daughter miss out on the time away from her father, but now she is missing out on time away from me since I have to work twice as hard to cover the costs. It's time for Nevada to start figuring out how to pay for the costs associated with incarceration with their general budget. We already have enough on our plates by being the sole provider for our children. It should not fall on us to pay for any portion of our loved one's incarceration. Please vote yes for SB 416. Thank you.
Thank you very much. Any additional callers on the line?
Hello. Can you hear me?
Yes, we can. Please go ahead.
Okay. Hello. My name is Yesenia Moya, Yesenia Moya, and I am here in support of SB 416 because as somebody that has grown up seeing various family members and or community members being in prison, I have lost count of how many times I've had to fundraise for general things as clothing or food baskets, or just in general trying to make put money on somebody's books, put somebody money on their phones. There's a lot of things that go into this, and it's just I echo everything that everybody else has said, and I appreciate the sponsors of this bill. Thank you.
Thank you very much. Next caller, please.
Good afternoon. My name is Jody Hocking, JODIHOCKING. I'm the founder and executive director of Return Strong, who, for those of you that don't know what we do, we work with people who are incarcerated and their family members. And so we're very deeply connected to this work and the things that happened. I also am part of an impacted family. My loved one is also incarcerated. We are here in support of SB 416. Over the past 2 years, it's actually been a journey for us in starting to understand how prisons are funded and why families of the incarcerated are paying for their loved ones' incarceration. Initially, we used to think this huge difference was because we were getting robbed by NDOC. Nevada's prison system is in dire need of funding. We lack programming, we lack jobs, which is why people are not working and consequently don't pay. It took my husband 4 years of waiting to be able to get a job to put food in a microwave, and he doesn't get paid for it. He just doesn't lose any more days. So making assumptions about those pieces are tricky because there's a lot more to it. The system, the way that it is built, is not sustainable. It places an undue burden on those who are already struggling, incarcerated people, and ultimately their families. The reality is, while it may not show up on the budget, someone somewhere is paying for it. And it's the families who remain behind being financially victimized by these policies. We understand it's complicated. There's the tip of the iceberg fight, which is what this miraculously would cause so much relief and provide for. And there's the root of the problem, which I think is a lot of the questions that you're asking are deeper answers than what we're here. States that fund their prisons through general budget appropriations have lower recidivism rates and better outcomes for both the people who are incarcerated after release and their families. These states are able to invest in education, job training programs, and the things that you've been talking about today. Time for Nevada to follow suit by funding its prisons through the general budget rather than relying on families who are left behind, who have done nothing wrong except love, care, and support their people. Doing so will ensure that our prison system has the resources it needs to operate effectively and improve outcomes for people entering back into our communities. We are here today in support of SB 416, and thank you very much for hearing it.
Thank you very much. Next caller, please.
Hi, my name is Janessa Premus, JENESSA I'm calling in support of SB 416. I have a loved one who's incarcerated within NDOC, and I see the pressure it puts on families. I'm in support of this bill and believe that Nevada needs to come together to figure out how to pay for the costs associated with incarceration with their general budget. It shouldn't fall on families to pay for any portion of their loved one's incarceration. Please vote yes on SB 416. Thank you.
Thank you very much. Next caller, please.
Hello, this is Susan Prophet with Nevada Republican Club, and I would urge you to pass this bill. I believe the previous caller had mentioned that they weren't quite sure how they got into such a situation like this, but I believe that some of you on this committee do know that there's corruption in our prisons, and there was a prison warden that was fired last year or the year before. And I would suggest that in addition to passing this bill, that you go back and investigate that gentleman and have him reimburse some of these people who were gouged for years, and also find out who he was paying off to get away with it as long as he did. That's my recommendation, and I hope you take it, and please pass this bill. I like to see you all working across the aisle on a bipartisan basis. Thank you.
Thank you very
I
much.
yield my time.
Thank you very much. Next caller, please.
CYRUSHOJJATY. I will ditto the previous callers. Thank you so much. And also, I heard some people try to call into the last testimony, but they weren't able to get in. So please fix that if you can.
Next caller, please.
The public line is open and working. There are no callers at this time.
Thank you very much. With that, we'll go to opposition. Here in Carson City, Las Vegas. You can't move, Mr. Benavides, because then I think you're getting up. And on the phone lines, opposition, please.
If you would like to testify in opposition to SB 416, please press star 9 now to take your place in the queue.
Hello, my name is Estee Paget. That's P-A-D-G-E-T-T. I am in support of Bill SB 416. I couldn't get through onto the line, so if you could please note that. I am an impacted family member, and I echo all the previous stories. Thank you very much.
Thank you very much. Next caller, please.
There are no callers choosing to testify at this time.
Thank you very much. And we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines, BPS, when you're ready.
If you would like to testify in neutral for SB 416, please press star 9 now to take your place in the queue.
Hello, my name is Chris Cavello. I've been sitting here on hold. I pressed all the correct star numbers. It did not give me an opportunity to say that I am in favor of SB 416. I don't know if there is a phone issue again or not, but I would like to briefly tell you that I did have a son who was incarcerated with an NDOC. I am on a fixed income as well as my husband. My son knew that it was a hard struggle for us to help put money on the books every month to give him much needed food. He did take a job. He finally got a job, I should say, at the camp with the NDF. And I want to say that after working a month, trying to earn enough money to help us help him get food, he ended up with $30 after a month. This is after the fees, the room and board, that type of thing. So $30 isn't much a month, but at least he tried to get that money because it was such a pressure for us to try to keep feeding him, plus pay our own bills, plus be on a fixed income. I am in full support of 416. I am so sorry that it wouldn't let me in sooner, but I have been sitting here on the line. I promise you that. Thank you for your time.
That's all right, ma'am. We're happy to have you weigh in. Thank you. Anyone else in neutral?
There are no callers choosing to testify at this time.
Thank you very much. Any closing comments? All right. With that, we will close the hearing on Senate Bill 416, and we will open the hearing on Senate Bill 240. Senator Neal, when you're ready.
I'll just wait.
All right.
Thank you, Madam Chair. Good afternoon.
We'll wait for the committee to, I think the committee's having until they're done with their conversation, and then we'll go to yours, Senator Neal.
We apologize, Madam Chair. We were discussing the calorie content of the meals served in prison. Sorry.
Okay, I understand that because sometimes the calorie content, it probably isn't enough. Thank goodness, Senator. Thank goodness, Senator. All righty. Please go ahead, Senator Neal, when you are ready.
Thank you, Madam Chair. Senator Dina Neal here to present SB 240, and I have next to me Darian Harris from Capital Advantage. So SB 240, New Markets Job Act, has been in the legislature since 2013. We reauthorized it in 2019. It has had $200 million of tax credits that are pledged against the insurance premium tax. With the 2019 allocation, we've been able to leverage $73 million in federal new market tax credits in order to do projects within the state of Nevada. I just want to give some quick highlights of what we've been able to do with the 2019 New Markets Job Act that we passed in 2019 and why we're doing the reauth early in SB 240. So we've been able to do Elko Community Center, where 11 CDEs invested roughly $32 million for a 30,000 square foot medical facility in Elko. We have been able to do a Las Vegas plumber and pipe fitter local union apprenticeship, where we put in $2 million investment of new markets, and then an additional 156,000 in new markets in order for them to run a training center. We've also done a Pahrump Community Health Center, which put in 5.8 million in new market funds, and then an additional 2.7 million of stacked federal funds. And then on top of that, we've managed to put money into 3 Square, which got and opened up another food bank that had an investment of new markets of $14.7 million by 5 CDEs, and then also had a stack of 2.5 million in federal new market tax credits. There's actually been a total of 27 projects since we've done the 2019 version. The bill in front of you basically drops it. It is a re-auth, but instead of 200 million, it's 170 million, and then it wouldn't kick in until July 1st of 2026, which is really FY 2027. And so the difference in this bill, and you see in the fiscal note that B&I talks about, is that it creates now an impact qualified community development entity. So on top of what we were already doing, which were qualified investments in low-income census tracts, it now creates a impact quality community development entity, which then creates a smaller pool where we will then be allowed to focus on smaller businesses. Because one of the issues that has popped up since 2013 is that new markets, although it helps a business that is attempting to do anything over 500K and over, we typically haven't been able to do a smaller investment into smaller businesses that may be less than 500K. And so the new markets, SB 240 is attempting to create the second program with the authorization of using the existing credits that we've approved in 2019. So what does this look like in terms of revenue? So currently, these credits are not calculated in our books. It's treated as negative revenue because of the 2019. And so ultimately, what would happen if this bill was to pass and it was the committee's decision, the revenue of 170 million in tax credits against insurance premium tax would then remain off the books until the 7-year period ran from the 2026 period to, what is that, 2032? 2033? 31. Okay, so he can. Well, really, it starts in 26.
Credits start in 26.
Well, no. So, no, because it doesn't. So I have to be clear on that, because B&I can start to have a conversation about the quality investments on July 1st, 2023. However, no credit can be taken until July 1st, 2026. Yeah. Yeah. But you can't say that because it's very clear that you cannot there will be no credits that drop out until 26.
Correct.
Okay. All right. Okay. I'm sorry, Chair. It's been a long day. All right. I'll stop.
Yes, it has. Okay. Yeah, you haven't sworn yet, so you're a jump ahead here. All right. With that being said, any questions on this? I feel like I need some clarification, Senator. So I'm not even sure what question exactly to ask. Okay. Just give me some more info.
Okay.
Thanks.
So, not yet, but I will let Mr. Harris jump in a minute. But, okay, let me back this up, because we have had extreme conversations in this building on tax credits. And trust me, I've thought a million times about killing this particular bill. However, because of the work, and I know the ROI that's actually happened from the New Markets Job Act, the way this bill is written, it is an early reauthorization of the 2019 credits and allows BNI to start looking at the new investments or having conversation with CDEs about new investments in 23. However, there is a 3-year window where 0 credits can be drawn down. And then the way New Markets has been structured, it typically is structured over a 7-year period. This one has a 5-year window. So we have a staggered drop down where it goes 0 and then it goes 15, 15, 15. Well, and so it doesn't all hit at once. It starts in 26, which is fiscal year 27, and then I believe it's roughly 24 million that comes off for investments every year for 5 years with this bill, because I'm dropping the number from 200 million to 170. So the prior authorization, when we passed the bill in 2013, it had 200 million. When we passed it in 2019, it had 200 million. This re-auth would drop it to 170 in tax credits, and it's only against the insurance premium tax. That I don't know what question. I'm just rambling at this point because you're not. I don't know what questions I'm answering.
I totally understand. Senator Titus, did you have a question? Would you like to make a comment, sir?
Thank you, Madam Chair and members of the committee. My name is Darian Harris with Advantage Capital. We are one of the original community development entities to participate in the Nevada New Markets Jobs Act when it was enacted in 2012, and we have continued to participate through its renewal in 2019. I just was here to answer any technical questions that you all may have and just offer my support for the bill. Thank you.
All right, thank you. Any questions? All right, well, Mr. Thorley, if you'd like to jump in there and put a sentence or two out there, we're all for it. No. I think we've lost some of our capacity to hear.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. So slight correction, I think, to what Senator Neal stated. So it was $170 million in investment, not tax credits.
Darian Harris for the record. Yes, that's correct.
Okay. I'm sorry. I heard $170 million tax credits. Sorry.
Darian Harris for the record. The $170 million is the total investment authority granted to the community development entities. The tax credit amount for that, I believe, amounts to about $98.6 million in tax credits.
So now I do have a question, if that's all right.
Absolutely. Go ahead, Senator Titus.
All right, so I just need some clarification on that now. So, all right, so there was $170 million where you were able to invest from 2019 to now, $170 million investment from the $98 million tax credits, correct? So it's not a 10 to, because I saw in some notes that it was like a 10 to 1. That's not that's more like 2 to 1. For every dollar you get $2 investment.
I believe the 10 to 1 that you're, Darian Harris for the record, I believe the 10 to 1 that you're referring to, Senator, came from BNI's report saying that the total economic output from the program has resulted into a 10 to 1 return to the state.
Okay, because I just want to make sure. This is a money committee trying to do the math correctly here, so thank you very much.
Yes, ma'am. Thank you.
Thank you very much. Additional comments, questions? All right. Thank you very much. Then we will go to support. Here in Carson City. Go ahead, please, when you're ready.
Madam Chair, members of the committee, Nick Vasiliadis here for the record on behalf of Advantage Capital Partners. I will keep my testimony brief, but there's a couple numbers from the BNI look-back study that I think is very pertinent, and I would encourage the members of this committee to take a look through the report that BNI put out, because I know this is a very complicated program. It's something that had been established in 2013. I can say confidently for any member who was elected to this body and was present in 2013, you voted for this already, and it was successful successful. It was a good program. That's why we brought it back for 19, and we were able to have another successful venture through this legislature in terms of continuing the impacts that it's having. Businesses in Las Vegas, North Las Vegas, Pahrump, Silver Springs, Sparks, Reno, Elko. So this is truly a statewide kind of impact. To Senator Titus, yes, that 10 to 1 ROI number is something that was drawn from the report that B&I did on the look back study, and that is total economic impact. And so I just wanted to make sure that that was crystal clear. The average salary, which you'll also see in the report, is about $25 an hour. So it's not, it's good paying jobs, as well as a good kind of, I would say, or argue, investment for the state. And lastly, I also think it's important to point out that 57% of the employees at these businesses are women or people of color. And so it's not, I think it's meeting its true intent, which when we brought this through in 2013, it was to specifically target areas that, based off the census tract, were economically disadvantaged. And the entire intent of this program is to focus in on that. And I think it's safe to say that this program has been pretty successful, and it's probably worth continuing. And with that, I would urge your support. Thank you.
Thank you very much. Please go ahead.
Thank you. Good afternoon, Chair Dondera Loop and members of the committee. For the record, my name is Nick Schneider, representing the Vegas Chamber, and we are also in support of SB 240. And in the sake of brevity, well, I'll just echo the sentiments of Nick V. Thank you.
Thank you very much. All right. Any additional support here in Carson City? Las Vegas? Seeing none, we will go to the phone lines. BPS, when you're ready.
If you would like to testify in support of SB 240, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. Those in opposition here in Carson City, Las Vegas, and on the phone lines. BPS, when you're ready.
If you would like to testify in opposition to SB 240, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines. BPS, when you're ready.
If you would like to testify in neutral for SB 240, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. And with that, do you have any closing comments, Senator Neal? All right, with that, I will close the hearing on Senate Bill 240. And before I open the Senate Bill 246 hearing, I just wanted to let all of you know, and I apologize if this has impacted your day, but we are going to roll Senate Bill 278, 279, and 307 to tomorrow morning. And there are some other meetings that are coming up, and we're going to run into some scheduling problems. So 278, 279, and 307 will be tomorrow morning at 8 a.m. All right, with that, we will open the hearing on Senate Bill 246. 246.
Thank you, Madam Chair. Senator Neal, for the record, for SB 246. So this bill, really, it comes from Section 4, where it has an appropriation in the back of the bill related to the general fund, and I have to give a brief history on this. So SNCC, the Southern Nevada Community Board has been around since pretty much since 2007. However, in 2015, when I chaired it, we were able to get approved by the U.S. Department of Commerce under the EDA for an economic development plan. pretty much nothing happened. I was able to raise maybe like $5,000. And then we got our economic development plan reapproved. I no longer chair it in 2022. So the EDA and the Commerce, we've always had an economic development plan related to the West Las Vegas and North Las Vegas in order to remedy blight that's in the area. There has been an economic development plan that has been approved by the U.S. Department of Commerce as of May 12, 2022. Chair McCurdy, who is currently on the county commission, asked for this appropriation so that the Southern Enterprise Community Board could then try to do some small grants and carrying out the improvement and an improvement project in these blighted areas that have been pretty much in existence for over 50 years. And so because there still has work to be done, that's what's pretty much in this bill. The fiscal notes from City of Las Vegas is coming from the workforce components that are in the bill, but they're already doing workforce. What I have in this bill is that you cannot, that in your creation of a workforce program, that you cannot give a preference over one minority group over another. You have to give equal play and target and share work opportunities related to economic development. And the same thing applies to the city of North Las Vegas, who has the second fiscal note. But as you know, for local government, we don't necessarily take into consideration their fiscal notes. We take into consideration the impact on the general fund. Also, and that's it. That's the money, the $5 million.
Okay, thank you very much. And so, just to confirm, the $5 million would go to
the Southern Nevada Enterprise Community Board. So there's been an account set up, I guess, over the past 15 years where it is run by the city of Las Vegas. The money is deposited into an account that the city of Las Vegas has in their budget, and it is a line item associated with that.
Okay, thank you. Questions? I'll give the committee just a second to read a little bit. Any comments, Senator Harris? Senator Gokachia.
Thank you, Madam Chair. And okay, now the $5 million, the way I understand it, is going to the city of Las Vegas for this workforce program? No.
No.
Okay.
So in Section 4, it only relates to the Southern Nevada Enterprise Community Board that currently has a comprehensive development strategy, which is a SEDS that has been approved by the U.S. Department of Commerce as of May 12, 2022. And so it's key that it only applies to Section 4. It would not apply to any of the previous sections.
All right.
Senator Neal, did you tell me or tell us that that we have done this before?
So we have had this particular law as a special act under Clinton. We've had this in law, the Southern Nevada Enterprise Community Board. We have had, that has been in statute. We've never given any money to it. I think in 2013, I think I might have had a bill that asked for like $350,000 when I was like a second term assembly person and it died. I mean, okay, but I have never brought a bill in order to ask for an appropriation. This request came from Chairman McCurdy, who currently chairs the Southern Nevada Enterprise Community Board, because this is our second time getting approved by the EDA in order for a comprehensive development strategy for the area. So the first time was in 2015 when I chaired that committee, and then we went forward and got another review by the U.S. Department of Commerce to review our community development, a comprehensive development strategy. And then they approved it in 22, and then we were told to establish goals and priorities for what we wanted to accomplish, and then the EDA then reviewed those goals.
Thank you. That helps. Thank you very much. All right. Any questions or comments? All right. With that being said, then if you have no more information to give to us, we will go to those in support.
I don't, unless you guys have questions on other parts
Well,
of the bill. But I wasn't supposed to talk about money.
That's exactly right. You did a really good job, and who knows what's going to happen in the next few minutes. Lots changes around here quickly. All righty. With that, we will call for those in support in Carson City for Senate Bill 246. In Las Vegas, seeing none. Going to the phone lines. BPS, when you are ready.
If you would like to testify in support of SB 246, please press star 9 now to take your place in the queue. There are no callers choosing to testify at this time.
Thank you very much. We'll go to opposition here in Carson City. Welcome.
Chair Don Daralup and members of the Senate Finance Committee, my name is Narna Benavides, Government Affairs Manager for the City of North Las Vegas, here today in opposition to SB 246. I do want to note that the city's fiscal note has not changed, as the bill will require additional staff and costs for bill inserts. And I also want to note that while we were neutral previously when SB 246 went to the Policy Committee, that has changed due to the floor amendment, Amendment 486, that added oversight powers to the City of North Las Vegas City Charter Committee, which is meant to be an advisory committee, not an oversight committee. Amendment 486 is also problematic because it also targets additional portions of the City of North Las Vegas Charter only, unrelated to the workforce development requirements in the original bill. While we understand what Senator Neal is trying to do with the workforce development aspect of the bill, we are concerned with the other components of this bill touching our city charter and what they can mean for the city. Thank you very much.
Go ahead, please.
Thank you, Madam Chair and members of the committee. Stephen Wood for the record, representing the Nevada League of Cities and Municipalities. And for the sake of time, I will just ditto Mr. Benavides' comments and say that the League of Cities supports North Las Vegas' position on this.
Thank you very much. Seeing no more opposition in Carson City, seeing none in Las Vegas, we'll go to the phone lines. Opposition, please.
If you would like to testify in opposition to SB 246, please press star 9 now to take your place in the queue.
I would like to ditto the previous speakers regarding 406. And I'd also like to bring it to your attention that there were several of us waiting to speak to oppose SB 240, and you said there wasn't anybody on the phone lines, yet we were waiting to speak. And I'm just going to tell you, the reason why I oppose both of these bills is because it carves out a special group of people. And that set of people, depending on their sexual preference, you know, any one of us could qualify by saying we were bisexual for this. So there's too many
we are
loopholes in
talking,
here.
ma'am.
I understand that low income and
Ma'am, I apologize that you didn't get to speak earlier, but we are on Senate Bill 240 and 246. These have nothing to do with anyone's sexual
Well, 246 I oppose, and I oppose to 240.
Okay, thank you very much, and I apologize again that you didn't get on the phone line. Would you state your name for the record? Thank you. All right, we'll go to the next caller on the phone lines.
TYRUSHOJJATY. I oppose this bill. Yield. Ditto.
All right, next caller, please.
There are no callers choosing to testify at this time.
All righty, we'll go to neutral here in Carson City. Las Vegas, seeing none. And we'll go to the phone lines. Neutral, please. BPS when you're ready.
If you would like to testify in neutral for SB 246, please press star 9 now to take your place in the queue. The public line is open and working. There are no callers at this time.
Thank you very much. Closing comments, Senator Neal.
Thank you, Madam Chair. So I just, since the non-money piece was brought up, I was discussed quickly SB 246, those sections. So as you recall, and I think we all do, that there was a bill that moved SB 184 that basically tried to give allow the charter committee to function within the city of North Las Vegas. And the argument that was made in several committees, in the Policy Committee on Assembly Government Affairs, Senate Government Affairs, and also in the governor's response, was that they wanted all of the process to amend the charter to go through the charter committee in regards to the expansion of the city council. And so this basically allows the charter committee to bring up issues within the city of North Las Vegas and basically creates a protection because there was a lot of testimony that came up in both of those hearings of the charter committee members saying that they weren't allowed to meet. And so basically what the bill does is guard that charter committee and allows them to meet without being, I guess, prevented from meeting. And so it also basically directs the clerk to also, post and not violate the law and some other issues. But that was what was added to the bill. And so the bill was only trying to accomplish that addition, which was done on the floor, was to accomplish allowing the charter committee to function because basically SB 84 died in the other house, and this amendment was done well before it died, to try to make sure that the charter committee that was there could bring issues forward since that was passed into law in 2019. I believe it was 2019.
Thank you very much. And with that, I will close the hearing on Senate Bill 246, and we will go to the last item on the agenda, public comment. Is there anybody here in Carson City for public comment? Seeing none, we'll go to Las Vegas. Welcome. Please go ahead when you're ready.
Thank you. My name is Leslie Quinn, L-E-S-L-I-E. Last name is Quinn. I have sat in live legislative hearings, watched various committee work sessions, floor sessions, read and listened to multiple bills and resolutions this 82nd legislative session. Bills and resolutions bent on the intentional destruction of the traditional family unit and adding heavy mental loads to our children. I am disgusted at the legislative push to erase humanity, emasculate men, erase women, dismember children in or out of the womb, obliterate the bond of the family, and erase our U.S. constitutional freedoms unless it suits your agenda. All of this is being done on the altar of inclusivity and economic social governance. Our children do not belong to the government or any special interest groups advocating infringement on the parent-child relationship. Legislators, you are elected officials voted by your district constituents. Respect all parents' rights to protect and be the authority for their children. Do not just select, not just a select faction or sect. Children do not and will never belong to the government. This is not a political party thing. It's a they are not your children thing. Respectfully, I ask Nevadan parents and parents everywhere, when did you surrender your children to the government? You are the rightful authority for your children. Do not allow the government or any special interest group to take away your God-given constitutional parental rights or put your children in harm's way. Our children depend on us as parents to serve and protect them. They are our future. To the billions of loving parents all over this planet, I say, stand up for all children. Make your actions, not just your words, clearly say to anyone or anything attempting to harm children, stop. Keep your hands off our children. Thank you.
Thank you very much. And seeing no one else in Las Vegas, we'll go to the phone lines. BPS, when you're ready, public comment.
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Hello, everyone. CYRUSHOJJATY. Despite some issues, I really did enjoy the session. Thank you so much for everything. And I have to also point out, I did enjoy the town hall last Saturday with Ruben De Silva, Commissioner Sickerbloom, Claire Thomas, Venicia Considine. Had a great productive time. You know, it makes me think that a lot of people who have concerns about this state, hardly any of them showed up. My goodness. But one thing I wanted to touch on was the fact that there's a lot of people out there who are wishing to go to an annual session. I do support that kind of idea, unless if we cap the number of bills to just do 300 to 400 every session. I really would appreciate if we can, put a floor so that way we have more time to look at the bills, because there's a lot of even good bills that get passed that I actually miss and don't really address my opinions about what's going on. So, I think that I don't like this Mission Impossible style where, trying to shove all the bills down, limited time, limited testimony. I really don't see how this is working well. So we can consider alternatives, and please pass on the comments to Senator Spearman, who talked about this.
Thank you. Thank you very much. And just so
Appreciate it.
you
Yield my
know,
time.
and just so you know, that everybody isn't in Las Vegas every weekend. So sometimes some people aren't there because they are here in meetings, which we were on Saturday. Thank you very much. And any other public comment in online BPS?
Hello, good evening. My name is Lorena Cardenas. That's LORENACARDENAS. To all the legislators, both on the right and the left side of the aisle, right here, right now, you have the opportunity to take control of a situation that has gotten out of hand. And but what I mean by that is that you're witnessing a very destructive social contagion that is affecting our youth. And by allowing people to get, I know Melanie Schiebel said and claimed that SB 163 wasn't giving transsexuals state-funded or taxpayer-funded surgeries. It was just it was equity. There's that word again, and making them just have health care as accessible to anyone else. But that's a lie, because they can actually use our tax-paying health insurance that they use to get these surgeries done. And I mean, these surgeries lead to a lifelong state of needing medication. And if you go on Instagram and Facebook and you look up on My Children's Advocate, you'll see testimonies of teenagers regretting this. And there's also another website called transitionjustice.org, where you'll see that it's not a lie. People that get these surgeries and they mutilate their bodies can no longer ever reverse the damage that's been done to their body, and they're suffering. And you have a real chance of stopping and slowing this down, because the way it's progressing, it's leaving a trail of mutilated children in its wake. I also had a personal experience there at Grand Sawyer, when I had a man in the restroom when I walked in, and it was very, very intimidating. He was towering over me, and I went in to use the restroom, and I had the phone on me nearby, hoping and crossing my fingers that I don't come across, obviously, someone that is mentally disturbed and is suffering from gender dysphoria, but that wouldn't want to turn on me. So how are we as parents supposed to think that it's safe to send in our daughters to a public restroom? I will never again send my daughter to a public restroom. And so I just want to say to this, where are all the feminists? How have you stayed quiet through something like this? You're so proud of being the first female-led legislature in the country, but you're allowing something like this to happen to women. This is the definition of hypocrisy. Please take this into account. Tap into your conscience, into your moral compass. Do not betray women with these bills that you're willing to pass. Thank you.
Thank you very much. Next caller, please. Public comment.
Hello, my name is Susan Profit, and I'm the Vice President of the Nevada Republican Club. And I would like to ask you all if you would please consider the oath you took for office. I am looking at these bills, and you are often shoving these through to the Senate for a vote when over 85% of your constituents, and in some cases 95 and more, are asking you and begging you not to, including the lady who just called in. I would also like you to please show Governor Lombardo some respect by approving his AB 400 and bringing his parental choice for education to Nevada so that we can improve our school systems, so that we can attract good doctors and improve our medical infrastructure. I would also like you to pay attention to your constituents when they beg you to pass Governor Lombardo's voter ID bill, which has yet to be brought to the floor for a vote. So please show him some respect and respect your constituents. I would really appreciate that, and I'm sure they would too. And thank you for your service. I do appreciate those of you that are fighting for us tooth and nail. Have a good afternoon.
Thank you. Thank you very
I yield
much.
my time.
Public comment. Next caller, please.
Public line is open and working. There are no callers at this time.
Okay, thank you very much. And with that, committee, we will meet at 8 a.m. tomorrow morning. We will have 5 bills and maybe another on the agenda, but we will see you at 8 a.m. And then we will recess and have another session in the afternoon. Thank you very much, and this meeting is adjourned.
Thank you.